Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our weekly Wednesday news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and briefly introduce who is on our panel today. We are joined by Amarillo Mayor Ginger Nelson, Casie Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamanteer, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We will open up to our panel to make statements, and then we will take questions from our media members who are in attendance. We'll start today with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm well, thank you, Dave, and hello, Amarillo. My heart is heavy this morning thinking about families that might be celebrating these holidays without some of the loved ones that they have a special place in their heart for. And I'm also thinking about our hospital workers and our medical staff that are working long hours this holiday. At the same time, I appreciate every citizen that's made a change in their holiday plans, every church, every school organization. We've all done holidays differently this year, and I want to say thank you. So from my heart, I want to say to all of you, very Merry Christmas. Thank you, Dave.
Thank you, Mayor. Let's now go to Casie Stoughton, Public Health Director for the City of Amarillo. Casie, how are you today?
I'm well, Dave. Thank you. I'm glad to be here to visit with our community this morning. As of today, there are a total of 28,397 total cases of COVID-19 in Potter and Randall counties, 14,890 cases in Potter County, and 13,570 cases in Randall County. We have a total of 23,237 recoveries, and we are thankful for each and every recovery. We do have 467 deaths here in our community in Potter and Randall counties, and we're heartbroken at each and every death. That leaves us with 4,693 active cases. Each of the cases do represent a unique individual. The total rolling 7-day positivity average for Potter and Randall counties is down to 9%. That's a big deal here in our community. And the positivity rate at the drive-through testing site is down to 31%. The 5-day new positive case average is down to 190 new cases per day. While that's still too many new cases per day, we are down significantly. The public health drive-through testing site remains operational today through 3 p.m. Individuals can call 378-6300 to be screened and directed to the test site. The drive-through test site and the report card will be available again Monday, December 28th, as the public health offices will be closed to the public over the Christmas holiday. GA32's hospitalization rate for the 25 county Panhandle RAC region does remain over the 15% threshold and has so for quite some time. Yesterday, the RAC hospitalization percentage was at 22.34%, meaning that just over 22% of all hospitalized patients have COVID-19. Our community does remain at status level red, and all of the conditions remain consistent with the indicators for the status level red. The outpatient bamlanivimab infusion center is open. We are serving patients there at that center that's between the two hospitals. We sent a health advisory to area providers with the referral information and encourage them to refer their patients who meet the EUA's eligibility criteria for treatment. Texas's published phase 1A criteria for vaccine allocation includes frontline healthcare providers and residents of long-term healthcare facilities. Phase 1B criteria was just released, and that criteria includes those residents who are 65 years of age and older, and people over 16 with at least one chronic health medical condition that puts them at greater risk for COVID-19 complications. We're at the beginning of week 2 allocations and still vaccinating those in group 1A. Stay tuned to local media and contact your private primary care provider's office for when we're able to shift to the 1B phase locally. As we move into the Christmas holiday, I want to say thank you for how we as a community have celebrated Thanksgiving. We changed our plans, we didn't have large family gatherings, and we wore our mask. In fact, we're still wearing our masks. And it's helping. Our numbers are inching down. And so today, on Christmas Eve, as my kids are calling it, I want to say thank you again for the way that we're going to celebrate Christmas and the Christmas holidays. We're going to limit our gatherings, we're going to wear our masks, and we're just not going to go if we're sick. And so I just really just want to say thank you as we're going to continue to see our numbers inch down. Thanks,
Thank you,
Dave.
Casie. Thank you, Casie. Let's now go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, how are you?
I'm good. How are you?
I'm good, thanks.
Good. You know, I think for the first time since this started, I feel like over the last week or two, we have not lost ground. It seems like every time we've come in over the last several weeks up until now, there's been a rising hospitalization rate and difficulties with getting treatment and getting difficulties with vaccines distributed, but those things have changed. And our hospitalization rate has stabilized and even decreased some, which is encouraging, although it's still critically high. 22% is still critically high. It's still certainly in the level red. I think that wearing masks has helped. I think that going around town, whenever we're out and about, I've noticed that more people are being compliant with that. I'm very appreciative to that, and especially to the businesses that are being compliant with that. We're very appreciative, and I think it's making a difference. And then finally, it's the vaccines. And as we've mentioned here, is that we're getting vaccine available. We're getting more vaccine available this week. And I think our efforts are going to be to continue to collaborate between the city, between the hospitals, between the other providers such as Texas Tech, to make sure that those individuals who need it most will get it first. And so that'll be our pledge over the next coming days, to make sure that happens. That's about all I have to say today, David. I'll pass it along to our other doctors.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital. Dr. Weis, how are you?
Hey, David, good. I'm appreciative this morning. So, this second surge has been rough, no doubt about it. I mean, it started in September, I guess for lack of a better term, it really blossomed in October and November. If you go back to the spring, when we first started this pandemic, I think it was met with, from our staff, with a lot of excitement. There was an enthusiasm for the challenge to face this virus. And I think the staff worked very well. And then during the summer, we saw maybe just an element of normalcy start to return to the community. And then this second wave hit. And I'll tell you, the staff is really suffering this one. And, just when the morale was getting to the bottom, I have to tell you, the people of Amarillo stepped up. And we received some incredibly generous gifts of food and other treats for our staff. And I want to tell everyone that what a huge difference that made, to tell our medical staff that they're being remembered, they're being thought of. So I want to personally thank all the restaurants, the banks, the churches, and all the other institutions in Amarillo that have given incredibly generous gifts to this hospital and to a lot of the other medical facilities, because it makes a massive difference in helping our staff work through this. I think the message today I want to deliver just in time for the holidays is hope. And I want to echo what Dr. Milton was saying is, I think there's good reasons for hope. One, we're seeing the numbers come down in the hospitals, and I'll talk about the Northwest experience here in a minute. Second, we now have more powerful tools, things like the bamlanivimab and the Regeneron we're giving as outpatients. And third, and most important, is the arrival of both the Pfizer and Moderna vaccines to this community. So I guess in many ways, this is an exciting time, because finally we start to see that there is hope that this will end. Let me talk about the numbers at Northwest. So today we have 93 patients with COVID in the hospital. Now, that is 19% of our licensed beds. To remind you, in early November, we were at 26%. So we've seen a nice drop in that over time. If you think about 93 today, we dropped below double or triple digits on December 13th. So before that, we were always exceeding 100 patients with COVID. December 13th, we dropped below 100, and we've pretty much stayed there. So we're seeing a nice slow trend downward in the number of patients with COVID in the hospital. We have 42 in our intensive care units, and 18 of those are on ventilators. We're using a total of 28 ventilators right now in the hospital. Unfortunately, we have seen 63 deaths from COVID in December. And that's going to put us on track to essentially, unfortunately, match November, where we're probably going to see 70 plus people die of COVID in the hospital. But I hope that this will be the end of this for this month. Right now we've gone from 3 dedicated med surgical units and 2 dedicated ICUs for COVID to now 2 medical surge units and just shy of 2 ICUs. So again, seeing more capacity, thankfully, as these numbers come down. Our outpatient testing was at 13% yesterday. So kind of mimicking what Casey's talking about, back in November, early November, we were at 26+% of outpatient testing positives. From the second week of December, we have dropped below 20%, and now we're tracking in the low teens every day in terms of the percentage of positivity. So again, all the numbers are trending in the right direction. And most importantly, we are down to 50 of our staff quarantined. We were at 150 2 months ago. So again, so everything is pointing in the right direction. The remdesivir we're using in the hospital, that's our inpatient antiviral we're using. We've treated a total of 601 patients right now, and we continue to have 17 on it currently. We have enough for 25 more patients. As Casie mentioned, the bamlanivimab, that's the outpatient monoclonal infusion we've been given. We have given it to 79 patients thus far. And I can tell you, talking to a lot of these patients, first, it's very well tolerated. Very few people have any reaction to the infusion itself. And most people feel pretty much better within 24 to 36 hours of this infusion. Now, remember, this is an infusion that a patient has to be referred by their provider to receive this infusion to make sure they meet criteria. And we appreciate the city and BSA and Texas Tech and helping set up a citywide resource for this now, that where patients can now be referred to receive this infusion. And then most important, the vaccines, we received a second allocation of Pfizer vaccines this week. We continue, as Casie said, on the phase 1A distribution, meaning these are the frontline workers, the hospital workers. We will coordinate with BSA and Texas Tech, the VA and the Public Health Department to move into phase 1B and subsequently together as we finish out each of these phases. Lastly, in terms of our procedures, we have really had to cancel very few elective procedures, thankfully, because we've been able to maintain some capacity. The few we have canceled is because someone just tested positive for COVID unexpectedly prior to the procedure. I guess my final word today is to use a kind of a hammy analogy. The last 9 months have felt like a football team that we've marched down 95 yards and we're at the 5-yard line before the end zone. We cannot fumble now. We're almost there. We're almost at the end. Now is the most important time for us to continue to protect ourselves, particularly during the holidays, until the vaccines will protect us from this virus. So please, that last 5 yards, we need everyone's effort to just hold on to the ball and let's punch it in the next couple months and hopefully by summer be back to a normal life. That's all I have. Thank you.
Thank you, Dr. Weis. Let's now go to Dr. Michael Lamanteer, Chief Medical Officer for BSA. Dr. Lamanteer, good morning.
Good morning, David. Thank you. Merry Christmas, Amarillo. We have an important holiday this week that we need to remember. And I'm glad that we're here to share that with loved ones, whether it be virtually or however it needs to happen. Make sure that you're spending time to reach out to your family and friends, call them, FaceTime them, do what you can do to tell them that you love them and that you're thinking about them, even if we can't spend the time with them like we have traditionally in close quarters. It's important to reach out and communicate to those that are important to you and that have helped you accomplish what you've accomplished in your life and career today. So thank those individuals and remember the holidays and what they mean. You know, I agree with everything that's been said here about the positive outlook that we have right now. And I think the positive outlook is that we've got vaccines, and the vaccines here are something that really has been really unheralded in terms of something that has been able to be produced so quickly and mass distributed with such a high efficacy rate for both of those that are now available to us is quite amazing. And we need to really be thankful for the scientists and the healthcare providers that are allowing us to get the vaccine, number one, produced, distributed, the companies that are doing that, the individuals that are that are helping us get that commodity to our sites to be able to administer it. And I'd like to say, as a point of thanks, that the individuals on this call today, with our local Department of Health, our mayor and her team of city leaders, Dr. Weis and his team, Dr. Gonzalez at the VA, we could not have had a better teamwork mentality when it came to what we needed to do to try to move forward through this pandemic. Accept the vaccine, work together about how we're going to distribute it. And I just want to say we're all on the same page, and it's really nice to know that we have people that are thinking about individuals and patients' lives at the forefront of everything we're doing above all else. At BSA, we actually have vaccinated nearly 1,000 Tier 1A employees and medical staff members as of yesterday. We're continuing to schedule individuals to march through that Tier 1A group, and hopefully have everyone that we need to vaccinate that agreed to be vaccinated over the next 1 to 2 weeks. We're working with the Department of Health leaders to make sure that we move to the next segment as outlined by the state appropriately, and we get vaccine to those that are going to be highest risk and of most benefit by getting the vaccine as the next candidates. I'm optimistic that across the country, I think we're going to be getting vaccine to those in the communities that are not healthcare workers, that are not labeled essential workers, but the general population more rapidly than is being initially estimated. I have confidence that our country is going to continue to really make this a high priority. At BSA, our numbers are continuing to slowly decline now, which is another positive. We're down to 105 patients today in the hospital. We dropped less than 100 yesterday, and we're still having a few admissions coming in, obviously, and we still have high numbers overall. Our hospitalization rate is clearly in the 20% range for the trauma service area. Right now, 32% of our actual inpatients, if you will, or hospitalized patients are COVID patients, so a third. For our licensed beds, that calculation that is based upon actual licensed beds, we're at 24% of those that are occupied with COVID patients. We have 76 total patients in our intensive care units, and 47 of those are COVID-19 patients. So what we're seeing now is a slowly dropping number of COVID-19 intensive care patients and a slowly rising number of intensive care patients that are non-COVID. And again, that is causing us to need to make some changes in terms of how we try to keep the COVID patients cohorted in certain areas because of the ventilation concerns and the nursing staffing and care concerns. But these are things that are much easier to do when we're at a number of 100 approximately of COVID patients compared to where we were, as you know, last month, at the beginning of the month, around 200 patients with COVID that were hospitalized at that time at BSA. So big difference. We're doing better in terms of the number of staff members that are quarantined. We're down to 60 total staff members. That's a blessing as well. There was a time when we had 150 plus staff members quarantined, which is very good news. Our ventilators right now, we're about a 57% utilization rate, which is also improved. And that's partly with the augmented ventilator inventory that we have here as well. From the standpoint of just kind of where we started at the beginning of the pandemic, I was looking at these numbers today. We've taken care of greater than 2,300 unique COVID encounters at BSA since the outset of the pandemic. And I was estimating low there, not to overstate it, but I think that's actually closer to 2,400 based on where those numbers were that I got Monday. For monoclonal antibody therapies, we're trying to use that resource as aggressively as we can. We've treated nearly 70 patients now with monoclonal antibodies at BSA, and we're working with our colleagues here on the phone, Northwest leadership, Department of Health, to make sure that our tent site is a good opportunity for all healthcare providers to refer qualifying patients to the tent or to BSA, and I think Northwest as well. We're all both accepting patients there as well to really provide the most chairs available, if you will, to be able to give this therapy for appropriate patients. It's just critical that you consult with your physician to make sure that you are meeting the criteria. We can't give that therapy to anyone based on the FDA regulations and the early use criteria. Testing wise, we reported in November that our testing positives were about 34% of all tests done at BSA. That's both inpatient and outpatient tests run through our lab. In December, we're running at about 17%, which is very similar to what Dr. Weis said for his facility in terms of what they're doing with positive rates with testing. Some of our clinics are having a slightly different number, closer to 20% positives in December, but they're having smaller numbers that they run. We're not doing any less testing. If anything, we're doing the same, if not more testing than we were doing previously. We do not have a shortage of tests. We're using two platforms, PCR and antigen testing, and making sure that when we have someone with a high clinical suspicion and we have an antigen test that comes back negative, we push that patient over to a PCR for inpatients, which is something that's critical in terms of how we cohort patients. So again, I think that's a good summary of where we are today. Very happy at BSA, our staff members, our leadership regarding the ability to vaccinate staff and give them some protection, that with the second vaccine booster, about a week after that, we should be having folks reach peak immunity based on what we're understanding from our folks that have produced a vaccine and have studied the results in our phase 3 trials. I want to thank again everyone at BSA that is a staff member taking care of our patients. I want to thank everyone at Northwest as well, all the frontline healthcare workers, Texas Tech healthcare workers, all of our medical staff members that have given up a good portion of their lives this year to take care of patients and the sacrifices you made. I want to wish you Merry Christmas, say thank you, and please try to spend some time, at least virtually, if nothing else, with your families this holiday. Thank you.
Thank you, Dr. Lamanteer. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, David. First, thank you for this opportunity. So, Mayor Nelson started this and talked about how many of us are doing different things over these holidays. So I was supposed to be this week with my family in California and visiting with them. Have not spent a Christmas, actually haven't even been there in several years, and looking forward to that. But as with many of you, we have made changes to our plans, and instead I am here and my family is in California, or my parents are in California. And so, but we are going to enjoy that, and we're going to do it virtually. Now, I will say today I got a great gift though. Just before dialing into this, I went down to our warehouse to watch our first 1,000 doses of Moderna vaccine being delivered to our hospital. And so right now our pharmacy team is doing all the things they do when we get things like this, verifying temperatures, checking the inventory. But then we're going to begin our vaccinations, and we're going to begin our vaccinations with the same priority you're hearing everyone else. We're going to begin with our veterans in our community living center, our long-term care facility, the staff there, and our frontline workers with COVID. And so we will get all these vaccinated. We too, after we get those frontline workers, will begin to focus on our outpatient veterans and others that we've been given the prioritization. Now, how are we doing on our numbers here at the VA? Very similar story. We are down to 7 COVID patients, 3 in the ICU, and 2 of those 7 are still non-veteran patients that we continue to take care of. So, previously we were around 20, so that's about a third of where we had been. When we look at our number of veterans that are having to go and get screened and test positive, we also are seeing that same general decrease. And why is that? That is because people are following those same restrictions we talk about every time. You're wearing your mask. You're practicing social distancing. You're not going out when you're sick. You are doing good hand hygiene. And so I would ask, please continue to do that. As Dr. Weis said, we've got that final 5 yards to go. We don't want to fumble now. And so please continue that. Even after we begin the vaccinations, we're going to need to continue that for a while as we watch the protection spread. So that being said, I will tell veterans, there is a way, if you are interested in getting the vaccine, on our Facebook page, there is a website you can go to, the VA has set up. I mentioned it on the town hall. Unfortunately, talking this website is horrible because of all the hyphens they threw in it. So please go to our Facebook page and register so we know who is interested in getting the vaccine. I can tell you from the 2,000 respondents we had to our question on that town hall, over 80% of our veterans want to receive the vaccine when they're eligible to receive it. And so we are going to let you know as soon as we have it, and you're in that priority group, we will let you know so you can get your vaccine. So we continue to have testing available. Just like Dr. Lamanteer said, we are not short of supplies of testing. If you think you need to be tested, whether you're symptomatic, asymptomatic, and you're a veteran, please call us. We can discuss with you testing options and get those arranged for you. And finally, I do want to thank our employees. Appreciate all they've done as we've gone through this COVID pandemic. I want to thank the many VA team members from around this country that came and helped us through this surge. Most of those have gone home now and are back. And I know we've sent people to other areas in the past, and we will likely be ready to send more of our staff elsewhere where that help is needed in the future. And so, but I do want to thank them. I want to thank our hospital workers that are going to be working during this holiday weekend. While I am home with my family, my wife and children, I know many hospital workers will be in the hospital taking care of patients, not just here, but at all of our hospitals, whether it's nursing, techs, lab, radiology. And so we appreciate what you do each and every day, despite whether it's a holiday, it's a weekend, or a weekday. We just want to say thank you. Want to thank our community partners. Dr. Weis, I think, mentioned earlier about the amount of donations we have received for our veterans and for our staff, and just say thank you. It's coming at a great time. And so with that, I want to thank the City of Amarillo for this opportunity, and thank my fellow veterans for the honor it is to serve you in this community. Thank you.
Thank you, Dr. Good. Let's now go to Jared Miller, City Manager for City of Amarillo. Mr. Miller, how are you today?
Doing good. Thank you, Dave. Just want to remind everyone that we have plenty of testing, like everyone else has said. We have plenty of testing capability. The drive-through testing center is still open. Feel sick, feel like you might have symptoms consistent with coronavirus, please call Public Health at 378-6300. They will screen you and refer you to the drive-through testing site. If you have transportation challenges and you don't have transportation to get to the drive-through testing site, please call Amarillo City Transit at 378-3095. We are still doing free transportation for people who have been referred to the drive-through testing site. We don't want there to be any barriers to people being able to test and see if you have coronavirus. We are still under Governor's Executive Order GA-29, which references face coverings and requires face coverings when people are out and about. There are some exceptions, but for the most part, everyone's required to wear a face covering. We're going to talk a little bit about that more in just a moment. We're also under the Governor's Executive Order GA-32. GA-32 is where we have the definition of area of high hospitalization. Right now, all of our businesses are limited to 50% capacity, with a couple of exceptions. Bars are not allowed to be open, and there are some essential services and services that are able to provide, that people can provide while social distancing, that are allowed to be open at 100% of capacity. But for the most part, we're at 50% capacity. Now, it's important to note how well our community has done over the last 30 days. We're exactly 1 month from the time where Council passed the Pandemic Emergency Measures Ordinance. Our city has responded so well. All the numbers are moving in the right direction. In no way does that mean that we need to now take our foot off the gas. We have seen how well wearing the face coverings work. We have seen how well the social distancing and the hand washing, the sanitation measures, once we took that much more seriously, how well it's worked with our numbers. 1 month ago today, we were over 40% on our hospitalization rate, and now we're at 22. As Dr. Milton said, that's still a high number, but we're moving consistently in the right direction every day over day. So now is the time to stay focused on aggressively following those measures, because they've been proven to work. Our hospitalization rates going down consistently, our positivity rates going down consistently, our number of active cases are going down consistently. All of the metrics are going in the right direction. So now is the time to stay focused on doing the things that we've proven that worked. and our community has really stepped up. I really can't say thank you enough to our community. And now as we go into Christmas and New Year, and we have the holidays and the gatherings that traditionally take place, want to encourage everyone to please take it serious. This will be our litmus test. How we can handle the next 10 days will really dictate what's going to happen in January, because we have a very real chance of going below 15 for 7 consecutive days, therefore letting our businesses move from 50% to 75%, allowing more economic activity here in town. And all we have to do is continue being diligent with our face coverings, sanitation, the social distancing. So thank you all for what you're doing. And I just want to encourage us as a community to stay focused on what works. That's all I have, Dave. Thank you.
Thank you, Jared. At this time, we're now going to go to members of our media. If you have questions from an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with David Furtado of KBI Channel 7. David, how are you today?
Doing pretty spectacular. How about you guys?
Very good, thank you.
Good. I just had a couple of questions. First, I wanted to talk to Casie real quick, because she mentioned how, you know, our area here in Potter and Randall County is 3.92%. And we've gotten some questions about whether or not, you know, this 3.92% gives us the ability to open. But that's just here in Amarillo rather than the whole trauma service area. So I was just wondering, Casie, could you kind of a little bit explain why people might be able, when they see the Amarillo thing, how that's not necessarily indicative of the trauma service area?
Right. So the 3.92% that's on the dashboard, that is the hospitalization rate. And what that means is that 3.92% of all of the active cases are requiring hospitalization. So that's a very separate number than, or separate percentage, a separate question even that is being answered than the GA32 hospitalization percentage of the 22%, the 22.34% of all hospitalized patients having COVID-19. So very different questions that has nothing to do with the 15% threshold.
Okay. And I hear like there was I know there's like a way for cities to essentially reach out to the governor and try to get some sort of exemption, but that has to do with like, I hear it's like you have to have only a certain amount of cases every 7 days. And are we over that amount? Is that why we can't go to the governor?
Yeah, so you have to have less than 20 active cases. And right now we have over 4,000 active cases. So we're not even close to being in that category. It's so important that we wear our masks. And like all of our panel members said, we've got to finish strong together, and we've got to move together as a community separately. We've got to, you know, wear our masks. We've got to socially distance. We've got to keep doing those things that are working right now in our community and really are moving our numbers in the right direction.
All right. Thank you, Casie. And my last question is kind of for the doctors on the panel, because I kind of want to get your professional opinion on this. I know it's been pretty quick on a turnaround with the vaccine on this novel coronavirus. And I know it's a synthetic vaccine, essentially a synthetic makeup of the protein, is from my understanding. Correct me if I'm wrong. But with that, could that kind of, in your guys' opinion, could that change the way we build vaccines in the future, considering how fast we were able to turn one around for this novel virus?
Well, I would just add that this form of technology is obviously has its advantages with this mRNA technology, because it can be ramped up quickly and distributed quickly. So certainly, I think it's going to change the landscape in the future of how we approach these kinds of problems. Hopefully they don't happen very often, but certainly I think as part of a general pandemic preparedness that this country needs to have from this point going forward for the next potential pandemic, I think all these technologies will be important.
I said, yeah, I just say, I think this technology is absolutely awesome, incredible stuff. And I agree with Dr. Milton. I think that the one challenge has been with RNA, which is with the Pfizer and Moderna, is the storage and transportation requirements. And I think as we learn to work that out, that'll be better, because right now these vaccines are still very difficult to get to underserved areas or places where you don't have very low freezers, things like that. But the technology is beautiful.
All right, that's all the questions I have. I really appreciate you guys taking the time to answer them.
Thank you, David. Let's now go to David Gay of the Amarillo Globe News. David, how are you today?
I'm good. Good morning, everybody. Just a couple of follow-up questions for Casie on the bamlanivimab center that opened between the two hospitals. When did that center initially open?
So we started serving patients yesterday, and we have been able to serve a total of 5 patients by referral.
Absolutely. And what's the how much of the antibody and how many people are you expected to serve over the next period of time?
So we're working with the hospitals on that, and it's really an ideal partnership. One that is just critical here in our community. We have the ability to serve between probably 8 and 16 patients a day. And then over time, we'll be able to probably ramp that up a little further. But right now we're able to serve between 8 and 16 patients a day. We have not had that many requests. And so we have been able to serve all of the patients for whom we've had referrals so far. We do anticipate additional referrals as time moves on.
Absolutely. And I guess the last question I have is for Dr. Gonzalez. You said that the Moderna vaccine came to the VA today. Do you know how much of that Moderna vaccine you guys received, and when, and my apologies if you answered this in your statement, when do you plan on starting vaccinations for these individuals?
Okay, so we should have received 1,000 doses. Like I said, it just came in. Box was still sealed last time I saw it. So the pharmacy will be verifying that inventory. We plan to start vaccinating today, probably shortly after I'm off of this. If they haven't started already, they are going to be, we have been waiting for it. And so we've got a team ready to go once we do all the checks you have to do, and we're going to begin our vaccinations today.
Absolutely. That's all the questions I have. Have a great holiday, y'all.
Thank you, David. Let's now go to, if I'm not mistaken, KEMR Channel 4. I don't think this is Aaron Langston. Correct me if I'm wrong. Let's now go to KAMR Channel 4. If we have a reporter there from KAMR, you can ask a question now. Okay, I think that's all the questions we had for our media members today. I want to thank all of our panelists for taking the time to join us and to provide this information to our community today. I want to wish everyone a Merry Christmas. This is David Henry, Communications Manager for the City of Amarillo.